National Party is extremely concerned about the state of Jamaica's health sector at this time. The Minister of Health and Wellness clearly cannot manage the portfolio, and the lives of ordinary Jamaicans are at risk on account of his ineptitude. This gross mismanagement of the health sector is not only confined to the hopelessly inadequate response to the dengue epidemic, but to other areas of the health sector at this time.
That argument has come from opposition spokesman on health Dr. Maurice Guy while speaking at a press conference at the PNP headquarters Tuesday morning. Dr. Guy argued that the minister has mismanaged the health portfolio.
He has to accept full responsibility for all that has transpired in the ministry. The dengue crisis, the deaths of our many children due to dengue, the overcrowding of the facility, the long delays in getting hospital beds and after being admitted, the resorting to chairs for delivery at the maternity hospitals, the shortage of vital drugs at hospital, and many more. The performance of Minister Tufton clearly demonstrates that he's not up to the job. It's unfortunate that he's the Minister of Health and Wellness, and his continued occupancy of the ministry forebodes a worsening situation and for this country an increase in mortality. The Prime Minister should now act to remove him and give someone the opportunity to rescue Jamaica from this imminent disaster.
He also pointed to the shortage of bed space in hospitals and longer waiting hours at health facilities.
We have had reports of longer waiting times at hospitals and health centers, longer time to see a doctor, and even when one is to be admitted, we have reports of shortages of bed to admit patients. In fact, some patients have to be accommodated in the emergency rooms, in chairs, and in some instances on stretchers awaiting bed availability on the wards.
And what of the ministry's response to the dengue outbreak?
Perhaps the most serious highlight today is that of the mismanagement of the dengue outbreak. My predecessor warned several times that dengue cases were rising, and there was a need for urgent management, including public education and vector control. We have seen where upwards of 63 patients, mostly children under the age of 10, reported dead since last year as a result of dengue.
Gabrielle Thompson, Frontline News.